Welcome. Today we are going to read about bronchitis, the types, causes, symptoms, treatment, and prevention. Definition: bronchitis is the inflammation of bronchial tubes in the lungs. Also, it's inflammation of the main air passages, bronchi, to the lungs. Bronchi becomes narrowing, mucus formed, and inflammation. It causes nagging cough. The tiny hair cells cilia in the bronchi traps and eliminate the pollutants. When the cells of the bronchi are inflamed, cilia stops functioning, causing the characteristic cough of bronchitis due to the heavy secretion of mucus. Types of bronchitis: acute bronchitis and chronic bronchitis. In acute bronchitis, it lasts for specific length of time and often caused by some viruses and then cause cold. It usually starts severe sore throat, runny nose, and sinus infection. Causes: viral infection, cold or flu virus, bacterial infection, tobacco smoke, air pollution, dust, fumes, and vapors. Pathophysiology: acute bronchitis because of the causes: irritation to the bronchial lining, increased mucus production, edema leads to diminished bronchial mucociliary function, clogging of airways by debris and inflammations. Signs and symptoms: cough, shortness of breath, wheezing, chest discomfort. The cough may be or may not be with phlegm, and malaise. Chronic bronchitis. Chronic bronchitis has similar symptoms as the acute bronchitis, but it is an ongoing illness. Causes: smoking, most common cause. Long-term exposure to air pollution, dust, fumes, and vapors. Genetic factors also is the cause. Respiratory diseases and gastroesophageal reflux disease, GERD. Pathophysiology of chronic bronchitis: due to the above causes, increased stress, oxidative stress, inflammatory mediators, fibrosis and thickening of airway, narrowing of airway, and leads to airway obstruction and chronic bronchitis. Symptoms: a persistent cough which may be produce mucus, phlegm or phlegm, wheezing, breathlessness, low fever, chest discomfort, sore throat, fatigue, headaches, blocked nose and sinuses. Treatment options: medications, bronchodilators, decongestants, antibiotics in case of bacterial infection, corticosteroids. Prevention tips: quit smoking, avoid smoke, dust, fumes, vapors, and air pollution. Wear a mask when pollution leads to levels are very high. Wash hands often. Get plenty of rest. Eat healthy food. When should you call the doctor? Cough brings out mucus that contains blood. Cough disturbing your sleep at night. Cough lasts for longer than 3 to 4 weeks. Experiencing chest pain or shortness of breath. Unexplained weight loss. Barking sound with cough. Unable to speak. The diagnosis made by vital signs, because patient will have mild fever, so TPR chart, BP, SpO2 monitoring and pain assessment. Auscultation for wheezing sounds, chest x-ray to rule out any type of pneumonia. Treatment 90% due to the virals, active viral bronchitis, only need supportive treatment. Drink more water, 8 to 12 glasses of water. It helps to thin out the mucus. Rest to the body, it vitals, it helps the repair your immune system. Humidifier, steam inhalation also helps. Doctor's advice, according to the doctor's advice, you give antipyretic and take expectorant. If it is viral, within 10 to 14 days it will be corrected. If bacterial, needs antibiotics, inhaler and to open up the airways, and oral steroids and bronchodilators. This is according to the doctor's advice. Nursing measurement to keep patent airway, you have to auscultate lungs for the air entry. If more secretions, need mild physiotherapy, chest physiotherapy. Assess mental status of the patient. ABG analysis must be monitored. Chest physiotherapy, IO chart should be monitored because patient is taking 8 to 12 glasses of water. Its hydration should be maintained and diet supplements should be taken to consider. Thank you.